How do functional and anatomical hiatal hernias differ? Imagine your stomach trying to sneak up into your chest through a tiny opening in your diaphragm. That's what a hiatal hernia is. But not all hiatal hernias are the same, and understanding the difference can help you better grasp acid reflux and gastroesophageal reflux disease. Let's break down what makes these two types distinct. Anatomical hiatal hernias are like a visible shift in the body's structure. They happen when parts of your stomach or other organs push through the opening in your diaphragm called the esophageal hiatus. The most common type is called a sliding hiatal hernia, where the junction where your esophagus meets your stomach moves upward into your chest. This accounts for about 95% of hiatal hernias. Because this displacement affects the position of the lower esophageal sphincter, or less, it often leads to acid reflux. The less is a muscle that acts as a valve, preventing stomach acid from flowing back into the esophagus. When it's weakened or displaced, acid can escape more easily, causing heartburn and other symptoms. The second type, paraesophageal hiatal hernias, are less common but more serious. In these cases, the junction stays in place, but part of the stomach, usually the fundus or other organs, push through the diaphragm alongside the esophagus. These hernias can cause complications like strangulation or obstruction, but they don't always cause reflux. Still, they can impair the less's ability to work properly, leading to symptoms similar to the sliding type. Now, functional hiatal hernias are a different story. They involve issues with how the esophageal hiatus and less work, rather than a clear structural shift. Sometimes, the anatomy looks normal or only slightly changed, but the muscles and nerves that control the less aren't functioning properly. This can mean the less doesn't relax correctly when you swallow or doesn't stay tight enough to block acid. The diaphragm's right cruce, a muscle that helps maintain the opening, might not contract properly, weakening the barrier. Also, abnormal esophageal movements or pressure changes can make reflux worse, even if the stomach hasn't moved much. So, in simple terms, anatomical hiatal hernias are about the physical displacement of stomach parts through the diaphragm, often visible and measurable. Functional hiatal hernias are about how well the muscles and nerves work to keep acid where it belongs, even if the anatomy looks normal. Both types can cause acid reflux and GERD, but their causes and treatments differ. Structural hernias might need surgery to fix the physical opening, while functional issues often respond better to medications that improve less function or lifestyle changes. Knowing the difference helps doctors choose the right approach to help you feel better.